Hi, guys. Thanks for joining me again. Today, I wanted to talk about a type of cancer that we see all too commonly in dogs and cats called lymphoma. Lymphoma is a type of cancer of a white blood cell called the lymphocyte. They're the white blood cells that go on to actually make antibodies, and so they're really important in the body. When these cells become cancerous, because they have access to the entire lymphatic system and because they're found in, all of our organs all throughout our body, this type of cancer can pop up anywhere, and it's considered to be a systemic cancer. And so that's why often, in most cases of lymphoma, surgery is not something that we recommend unless it's either just isolated to the spleen or a single organ, which is uncommon, or if it's causing a blockage. So, for instance, if it forms a mass in the intestine that's blocking flow, that would be a situation where we require surgery. But in most cases of lymphoma, we're talking about chemotherapy. Lymphoma, again, is the most common cancer of dogs and cats. We see two major forms of lymphoma. One is called large cell lymphoma. We also can see kind of a subset of that that's a bit more aggressive, but generally speaking, large cell lymphoma is when these lymphocytes, these white blood cells, are really immature, and when they become cancerous, they really don't listen to any sort of regulation throughout the body. And so this type of lymphoma develops very quickly and can spread or progress very rapidly. The other type of lymphoma that we'll see is actually called small cell lymphoma, and that is a more slowly progressive form of cancer. That is actually a bit more common in cats, but we are seeing it more and more in dogs. Fortunately, that type has a longer survival time. It doesn't tend to progress as rapidly, and so it's kind of we treat it a bit differently. Going back to large cell or high grade lymphoma, it generally presents in dogs most often with big lymph nodes. So a lot of owners, as they're petting their pet or they take their dog to the groomer, they'll notice lumps under their chin or sometimes in their armpit region or groin area, and that often is what prompts them to go to the vet. In other situations, we can find that these patients will have like gastrointestinal symptoms or some other symptom that brings them in, and then during the workup, we find evidence of lymphoma. But kind of the textbook case is the generalized lymph node enlargement that's found by the owner. There are 5 stages of lymphoma, large cell lymphoma. Stage 1 is a single lymph node involved. Stage 2 are regional lymph nodes that are involved, so lymph nodes that are on the same side of the body. Stage 3 is generalized lymph node enlargement. Stage 4 involves the liver and or spleen. And stage 5 involves privileged sites like the bone marrow. Typically, when we're diagnosing lymphoma, we often can get a diagnosis either on cytology, which is basically just a cell sample, so introducing a needle into an area of interest and sucking out some of the cells, or biopsy, where we're actually getting a piece of tissue. There are some situations where special testing, like special stains or DNA or PCR testing, or even some molecular testing to see what receptors are on the cells, sometimes we need those additional tests to help make the diagnosis of lymphoma. But generally speaking, a lot of the blood cell cancers are easy to diagnose or fairly easy to diagnose with just a cell sample or a tissue sample. Treatment, on the other hand, for lymphoma, since it's considered to be a systemic disease, a systemic cancer, we're reaching for chemotherapy. Chemotherapy is often the treatment of choice for this type of cancer because it's systemic. There are some situations where radiation therapy to shrink a mass may be used, but again, generally speaking, chemotherapy is the way that we're going to treat this cancer. There's a number of different treatment protocols that are utilized, but given that this is an aggressive cancer, most of the protocols are going to involve injectable chemotherapy. This is where it starts to get a bit out of my wheelhouse, so I'm not going to go into the details of the different chemotherapy options. But if your pet has been diagnosed with lymphoma, I highly suggest that you talk to a medical oncologist to go over your options. Even if you elect to not treat with chemotherapy, having that information is very, very valuable. It helps you make the most informed decision for you and your pet. And dogs and cats honestly tend to go through chemotherapy a lot better than people do. And even though we're using a lot of the same medications that they're using in people for similar types of cancers, the dosing that's utilized in cats and dogs is a fraction of the dose. Oncologists truly, and I think all veterinarians feel that quality of life is the most important thing when it comes to treating a pet. And so it's not worth it to make them, sick or put them in the hospital to treat this type of cancer. And so again, they tend to have a really good quality of life going through it. They may have some, self-limiting GI symptoms. Again, oncologists are really good about providing medication so that you can try to treat these things or prevent, those mild illnesses from happening. And then it's really rare that chemotherapy will put a patient in the hospital. It does happen, but it's uncommon that that is the case. And so again, they generally go through chemotherapy fairly well. Chemotherapy for large cell lymphoma, again, is often injectable, and it typically is a protocol that lasts several months. But again, it's a treatment that if, after a round or two, it's not helping, or it's making the pet sick, or just not accomplishing the goals that you and your oncologist have set out for your pet, then it's something that can be discontinued. But often it does provide a significant survival advantage compared to pets with large cell lymphoma that either aren't treated or are treated only with steroids. And some of that is because cancer cells are very smart. And if you're only exposing that cancer to one medication, so like steroids, for instance, steroids are actually known to induce multidrug resistance in these cancer cells. And so if you expose these cancer cells to just one drug, one chemotherapy medication, it's easier for that cancer to beat that medication. Versus if you switch things up and expose it to a number of different chemotherapy drugs, it's much harder for that cancer to beat all of those different drugs. Eventually it does happen. So these are cancers that it's rare for a pet to be cured. And so again, we're looking to extend their survival and improve quality of life overall to kind of give them and their owners more time. Going back, so we kind of covered the large cell lymphoma piece, and again, there's more to it. And so it's important when you talk to your oncologist, they're going to want to know not only the stage of large cell lymphoma, but also what type. So there's B and T cell lymphoma. And then depending on what type of chemotherapy is given, the survival can vary quite a bit. And so again, those are things to talk with your oncologist about. As far as small cell lymphoma is concerned, we tend to see much longer survivals with these pets. Again, cats tend to get it more often than dogs do, and generally when we see it, it often is within the gastrointestinal tract. It can be in other organs like the spleen and the liver and lymph nodes, but often the gut is where we see small cell lymphoma develop. Often the symptoms for cats and dogs with small cell lymphoma can actually be very similar to other gastrointestinal diseases like inflammatory bowel disease. And so often we need a biopsy to know for sure what we're dealing with. Once we have the diagnosis in hand, so again, biopsy either of the gastrointestinal tract, which we can do with endoscopy, which I love doing, so we can get biopsies that way. In some cases, the diagnosis can be made with a cell sample, so cytology of the local lymph nodes or whatever organ we think is diseased. And once we have that diagnosis, most often we're talking about starting a steroid, and we generally start an oral chemotherapy medication. The one that I use most often is a drug called chlorambucil, and actually it's a drug that I use for patients with really bad inflammatory bowel disease as well. But it slows down turnover of these cells and actually can kill these cancer cells. Typically with small cell lymphoma, we can treat these patients for a year and a half before the cancer cells start to beat our medications. And so during that time, again, other than having to receive these medications, again, they often feel better than when they were diagnosed, and again, have a longer survival than if we didn't do anything at all. Once we kind of hit that year and a half mark, if the symptoms start to come back at that point, then that's another point in time where I'm referring to a medical oncologist to talk about more aggressive chemotherapy. And so there are things that can be done at home to start, where again you're administering a medication and then coming in every few months for lab tests. All the way up to, even sometimes using injectable chemotherapy through a medical oncologist. And so there's a number of things that can be done to manage these diseases. Most often, again, like large cell lymphoma, small cell lymphoma, we do feel is ultimately fatal. Now, a lot of the pets that get small cell lymphoma, they tend to be middle age or older. And so that question becomes, if another disease comes into the mix, could that cause them to decline before their small cell lymphoma? And it's certainly possible. But with enough time, and if nothing else occurs, again, generally these sorts of cancers in dogs and cats are considered to be fatal. But again, I think these are things that are worth treating. I think we improve their quality of life for a significant amount of time. And again, their quality of life during the treatment is often really good. So I'm going to point you to my colleague, Dr. Lori Cesario's site. She's a medical oncologist. She's someone that is very dear to my heart. I trust her 100%, and she has really good information about different cancers. And so I'm going to point you in the direction of her website to get some more information. And again, if your pet's been diagnosed with cancer, I highly and strongly recommend scheduling an appointment with a medical oncologist to discuss the options and just help you make an informed treatment plan. Okay, thanks for joining me again. I'll see you in the next episode.